Hello, I'm Erica Miller. I am a nurse at Barberton Summa Hospital. I've been a nurse there for almost 18 years. I graduated from Stark State back in 2007 and worked at Barberton ever since. I moved here to Massillon in 2017. I've been in Stark County though my whole life. Graduated from McKinley High School, 95. So I've worked at Summa. I work in a progressive care unit. So a progressive care unit, people are usually on telemetry monitors, a little more care than just the average bear. And so Summa offered to send me back to school for my bachelor's degree. And so that's what I'm doing, and that's why I'm here. So Massillon has a population of about 32,000 people, and 19.7 of that population are 65 or older. Senior citizens, they face unique health challenges just because our bodies are changing, and so you have different needs as far as nutrition goes than you did when you were younger. All right. So I'm here to talk about nutrition. That's why I'm here, and I appreciate you letting me talk. All right. So why is it important? Nutrition is important because it maintains, I'm sorry, I'm on the wrong side. It maintains overall health. Proper nutrition helps support your immune function. It helps reduce the risk of chronic diseases, and it helps you recover when you do get sick. It also prevents malnutrition. As we get older, we become higher risk for malnutrition. Due to a reduced appetite, you're just not as hungry. Some of the medications you're on might make you less hungry, and limited mobility. Nutrition also helps boost energy levels. Meals can provide essential energy, improving physical and your mental vitality. Also helps with cognitive function, nutrients like omega-3 fatty acids, and antioxidants help support brain health and can help reduce any kind of cognitive decline. It promotes heart health. Lean meats, all that stuff helps reduce your risk of cardiovascular diseases such as high blood pressure and heart disease, and supports hydration. Staying hydrated is crucial for digestion and circulation and overall well-being. And between what I've looked up and talking to the dietitian, hydration is huge for us as we get older. Some tips, especially for older people, for senior citizens, you want to focus on protein, lean meats, fish, eggs, and dairy for muscle mass and strength. Increase your fiber intake, whole grains, fruits, vegetables, helps support your digestive health and helps prevent constipation. Stay hydrated, once again. Drink plenty of water, herbal teas, and low sodium broths that'll help maintain hydration and support your functions. And just watch your salt and sugar, reducing sugary foods, beverages, processed foods to help manage weight and lower blood pressure. My dietitian did tell me if you do a lot of people like TV dinners are easy, healthy choice. A lot of those TV dinners are lower in sodium than others. And then you want to make sure you watch your vitamin B12. B12 helps with nerve health. That you find those in fortified cereals and meats, and you can also take a supplement, from a pharmacy. Alrighty. A lot of this information I got from it is called the National Institute on Aging. This little chart here, it has all kinds of cool things like recipes, meal plans, recipes on a budget, what you should be taking in if you're not that active versus if you're more active, stuff like that. So if you get bored and want to look something up, that's a great resource. Hydration, increase fluids. Make sure you increase your fluids. As people age, your sense of thirst just diminishes. So it puts you at a higher risk for dehydration. Hydration it's important because it supports your kidney function, regulates your body temperature, aids digestion, and it just overall is, it helps maintain your health. As we get older, we are at a risk for dehydration. You just don't feel as thirsty. Some of the medications you're on cause dehydration. And I think, at least for me, a lot of my patients, they're on meds that make them pee, so they cut back on their fluids because they don't like that. So the problem with that is it can cause urinary tract infections, confusion, kidney problems, and it also can increase your risk for falling down. So I have things here to these two little charts here, just things that help remind you. You can set your phone, just remember to drink. There's fruits and vegetables that are hydrating, like watermelon, beans, leafy greens. And look at your medications, see if any of them might be causing you to become dehydrated. Signs would be thirst, your urine's really dark. What else?
Senior center too.
Dry, sticky mouth, you know, all the normal signs of when you're thirsty. Those would be signs of dehydration for you. And then I just did a little thing here on heart and diabetes. My dietitian from SUMA, she did give me pamphlets if any of you want them. They're really nice. They have suggestions on fruits and vegetables, what's good and what's not good. You can do canned and frozen fruits and vegetables. You just don't want to use the ones that have a lot of added sugar and stuff. So those are listed there. And diabetes, SUMA uses the plate method. It's a nice way to measure without having to measure. You take your plate, you cut it in half, and the first half you're going to do like non-starchy vegetables, such as like green beans. Sorry, I lost my place here. Green beans, broccoli, asparagus, squash, Brussels sprouts, those. And then on the other half of the plate, the top half, you would do starchy vegetables, whole grains, like potatoes, a piece of wheat bread. And then the bottom half, you would do your lean meats, such as lean proteins like beef, fish, cottage cheese, and eggs. And also you want to do like 2 to 4 servings of fruits and 2 to 3 of milk. And lastly, I know once you're a senior, a lot of people are on like a fixed income, and everything's getting more and more expensive. So if you or anyone you know are having trouble finding foods, I went to the Massillon Health Department. I have a nice little list here of community meals and pop-up pantries. If you or anybody you know are in need of food, this list, and not just in Massillon, but Stark County, like the community meals at churches, they're free to the public. And then the pop-up pantries are usually, like, for instance, Massillon Health has one every third Tuesday, and they're from 12 to 2, and they hand out groceries and food items for people in need. They do suggest you get there a little early because it does pack up pretty quickly. I don't know if you've ever drove by, but I've seen like over here by the church, they line up pretty quickly. So that's pretty much it. I really appreciate everyone listening to me, and I'm sorry, I'm really nervous. So
You're fine.
oh, well, thank you. Does anybody have any questions or concerns? How'd I do?
Good.
All right, well, thank you, everybody. I appreciate you taking the time to listen to me, and enjoy the rest of your sandwiches.
Thank you. Thank you, Erica, and good luck with everything.
Oh, well, thank you. I appreciate it.
Vitamin B